Hi, I'm Cindy Morales. Welcome back to the Shout My Story podcast, where we share stories of women who choose life in difficult circumstances and the people who help them. If you like our content, be sure to like, subscribe, and share. Now, let's get to our guest. At the Shout My Story podcast, we usually concentrate on life issues at the time of birth, but the pro-life stance is a lot broader than that. We're womb to tomb, or you often hear the phrase from conception till natural death. And we're still fighting abortion on the legal and moral front, but in the past several years, the issues at the end of life have become a much greater concern. In particular, there's something called medical assistance in dying laws that are being passed state by state. I believe it's 10 or 11 states right now, and believe me, it's coming to a state near you. And this issue is very personal to me because recently I had the privilege to sit at my mom's bedside while she died. I was with her last 10 days and saw her transition from this life into the next. And the contrast of what I witnessed with my mom's death and what medical assistance in dying, or what should really be called assisted suicide, the difference just really struck me. So I wanted an opportunity to talk about it. So we're bringing on my good friend, Dawn Fitzpatrick, because she's kind of an expert in this area. Dawn is the former senior coordinator for the Office of Human Dignity and Solidarity for the Archdiocese of Chicago. And she managed the Respect Life Ministry for 9 years. And in that capacity, she had a lot of opportunity to learn about medical assistance in dying and the growing concern with assisted suicide in the United States. She holds a master's degree in communication, and she has a graduate certificate in theology, and she is another expert on the theology of the body of John Paul II. So thank you so much for coming on the show, Dawn.
Well, thanks for having me. It's great to see you again, Cindy.
It is. Dawn used to live in Chicago, and she moved far away. So this is great.
Yes.
Let's talk about first, what is assisted suicide? What is it?
Well, it's when someone has a terminal illness and they decide that they no longer want to continue with that illness, so they want to hasten their death. So they seek out the assistance of a medical professional who will prescribe a lethal dose of drugs to allow them to hasten their death in the privacy of their own home or wherever they decide. So yeah, it's killing yourself with drugs is what it is.
But they don't like to call it assisted suicide.
Oh no. As a matter of fact, they call it medical assistance in dying or medical aid in dying or death with dignity. Because as we know, the trend in the last, 20, 30 or more years is we take things that used to be values for us and we make them look like bad things, and things that used to be bad things and they make them look like values. And in doing that, they kind of hijack our language and make something seem very pleasant when it really isn't. So medical assistance in dying or death with dignity sounds fine to people, unlike physician-assisted suicide that you would realize is really a horrendous thing.
I want to talk about the main lobbying group behind the medical assistance in dying laws, which is called Compassionate Choices. And so
Compassionate Choices. Yeah.
Yes, which sounds good. That sounds almost even better than medical assistance in dying. And I think it does adequately reflect what they believe they are doing. So much of people who are pro-choice in abortion, people who are pro-assisted suicide, they think what they're doing is good. They think it's a positive good. They're helping people out of bad situations that no one should be in. So I had, as you know, an opportunity to go to one of the Compassionate Choices workshops. And I just got their magazine yesterday or 2 days ago, where I had an opportunity to peruse it and see, more of the language that they use. And they did feature some guy who killed himself in California. And of course, he went gently into that good night, according to that article. So we're going to talk more about that later. But first, I want to talk about what are the criteria that Compassionate Choices pushes for the medical assistance in dying laws. What do they say? Like, these are what you need to do in order to kill yourself.
Well, first you have to be 18 years of age, and you have to be a legal resident of the state where it's legal, unless you're in Oregon, where people can make it a destination. You must be capable of making decisions at the time of the prescription and the administration, and you must have a terminal illness with less than 6 months to live. Those are the basic criteria.
And so when I went to their workshop, they made it sound pretty reasonable, actually. That's if you accept the premise that it's okay to kill yourself, like if you're suffering or whatever. You have to have that as your basic premise. But a lot of our society does because of bodily autonomy, bodily choice. This is my life. I'm dying. Who are you to tell me I can't kill myself? Shouldn't I be able to kill myself, in a comfortable way? Okay. So why is this not okay? Like, why not first from a Catholic perspective, and then from since not everybody's Catholic, a non-Catholic, a natural law perspective or a non-Catholic perspective?
Sure. Well, from a Catholic perspective, we understand that our life is precious and that it is not our choice when to die. That's for God to decide. And we also realize that, you know, sometimes suffering can be redemptive for us. The fact of the matter is that we can offer our suffering up and then for souls in purgatory or for our own soul at the end of our time here on earth. And we realize that that's what Jesus did. He didn't just say, go ahead, take my life now, or he didn't even stop the proceedings of killing him. He allowed himself to suffer for our sins. So we understand that that's the model of how we should die. I mean, certainly he taught us how to live, but he also taught us how to die. So that's that's the Catholic perspective on it. Not to mention the fact that you're already second guessing God if you decide that it's time to kill yourself. Maybe he has a bigger plan for you. He does have a bigger plan for you. His plan could include a miracle that you're not allowing yourself to have if you decide it's time to end it or hasten your death. So that's the Catholic perspective. I mean, certainly from the secular perspective, there's so many dangers in legalizing something like this and in what can happen. I mean, for instance, this enables elder abuse because you have somebody who's old with a short prognosis for their time to live. Maybe they are suffering, maybe they have memory loss. Um, and so someone who is their caretaker decides, well, it's really their time. So we're going to go ahead and it's unsupervised. So we're going to go ahead and help them to take these drugs, whether or not they really know what they're doing. So that's one danger. There's also the fact that cost containment is an issue. If someone may have a terminal illness that could be cured with an expensive procedure, the insurance companies, and this is already happening in the states where it's legal, the insurance companies are denying the life-saving procedure that could be effective because it costs too much. And instead, they're saying, you know what? We're not going to do that life-saving procedure, but instead we'll let you have this medication, is what they call it, because they soften what it is, this medication that will allow you to go into a peaceful death quickly. Okay, so that's what they're saying. Because that may cost $100 or a few $100s as opposed to thousands of dollars of the life-saving procedure. We also worry about the disabled because they're in the same predicament as the elderly, where they have caretakers who may decide that they don't deserve to live anymore or they shouldn't live because their life isn't worth living. We have a lot of people in the disabled community have been working with us to try to fight this because they definitely like their life. They definitely consider their life worth living, and they don't want people making that decision for them. There's also an issue with the mechanics of the drugs because the fact is it's an experimental procedure. There's still nothing that's a protocol, so to speak, as far as what is really the best way to do this. So they keep trying different things. Like they try to tell you it's take a little pill and it'll put you to sleep. But the fact is they haven't been able to do that. So there's often lots of pills, and they're big pills that are just impossible to take. So the people will, start to take them and they won't be able to get them all down, and then they fall asleep, and and then they're ill because they couldn't get all the drugs in, but it was enough to make them sick. Or they end up having to try to make a slurry out of it, and then it's so bitter. Or they'll take the crushed pills and put it in applesauce and try to eat it, and it's just horrible. But anyway, it's just not a pleasant experience. It's not, and they don't know who's going to react to it and who's going to die from it. So sometimes people don't die from it; they just suffer from this procedure of taking the drugs. So that's an issue. We also have doctors that are being forced to participate against their consciences. There's many doctors who recognize that they're in this to do no harm. They're in this to help people. They aren't a doctor who should be helping people to die. They should be helping people to live. So unfortunately, some of these states are requiring doctors to do this against their consciences. Another thing that I think is really interesting is there are states who are falsifying, court documents now, like death certificates. So in the state of Washington, on their Department of Health website, there's a letter that's called the Instructions for Physicians and Other Medical Certifiers for Death Certificates. Also, the Compliance with the Death of Dignity Act, which requires anyone who puts together a death certificate to falsify the records. So, for instance, it says the underlying terminal disease must be listed as the cause of death. It says the manner of death must be marked as natural. The cause of death section may not contain any language that indicates that the Death with Dignity Act was used, such as suicide, assisted suicide, physician-assisted suicide, death with dignity, I-1000, mercy killing, euthanasia, secobarbital or seconal, which is some of the drugs that are used to actually
Wait, so
facilitate
time out.
death with
So
dignity.
basically, when you kill yourself in the state of Washington, what goes on your death certificate is what you're supposedly dying from, that you died from, say,
Yes.
cancer, even though you killed yourself.
Yes.
Okay. All right.
Absolutely. So this is I'm just reading to you directly from their Department of Health website. It's just it's ridiculous what's going on here, and people don't necessarily realize it. So these are all problems with physician-assisted suicide, also known as death with dignity and other things. It's also something that's going to affect low-income and minorities negatively because they may not have, really great insurance that helps them to get these procedures that might help them. So instead, it's suggested that they take these drugs to go ahead and kill themselves because it's cheaper. And interestingly enough, in the country of Canada, they're actually recommending this as a treatment for homelessness. Homelessness typically isn't something that you're going to die from in the next 6 months, necessarily.
Right. So basically,
and
basically, you start out with these strenuous criteria that Compassionate Choices recommends that sound very, very reasonable. Oh, you have to be very close to death. Mm-hmm. So one of the things they said in the workshop I went to is we're not killing anybody. They're dying already, so we can't kill them. We're just speeding it up by a couple of days. That's how they put it. Okay. So it sounds very, very reasonable, but once those laws are passed, those criteria start to become considered an obstacle to being compassionate in other cases. Yeah. So you got homeless people, you have people being denied care. And in countries like, Canada, I want to point this out. It's the third or fourth leading cause of death in Canada now. I think they legalized medical assistance in dying in 2016. So in 8 years, it's gone from, it's just going to be a few people, they're very, very into their life, to the third leading cause of death. And as you said, people who are homeless. Specifically, there was a guy who he was on disability, but he couldn't get housing because he needed special housing. He couldn't just go anywhere because of his disability, and he was requesting medical assistance in dying because he was homeless. That was not too long ago. Also, This is something that's I think is so ironic. I belong to an organization also. Oh, I don't belong to it, but I subscribe to their newsletter, Death Penalty Action, and they protest the death penalty in any time one comes up with the idea that even if you commit a very horrible crime, even if you're not innocent, we shouldn't kill people. And one of the reasons is because it's cruel and unusual punishment, and the ways that we kill people legally that are considered cruel and unusual punishment by death penalty action, lethal injection, there's a new suicide pod. They basically, it's anoxia, it's nitrogen being pumped in there instead of oxygen. Well, they just killed somebody off like that in either Tennessee or Alabama this week. And the person struggled horribly. Somebody who witnessed it put it all on Twitter. Right. So the very things that are considered cruel, unusual punishment in the case of killing off a convicted criminal are considered compassionate and kind if we're killing off an old or a sick person, which I think is deeply ironic.
Yes. It's it really is. And this all became front and center with Brittany Maynard back in like 2013 when they took this beautiful young woman who was dying of glioblastoma, and they convinced her and her family that she should become the poster child for compassion and choices. And interestingly enough, at first she decided not to do it, and she said, "I'm okay. I've decided to put this off." And then suddenly, very soon after, she went ahead and took the medication, and she was then. It was publicized that she went into a peaceful death with her family at her side, and it was beautiful. And so that made it almost a popular thing. I remember a friend of mine who's also a Catholic posting on Facebook something like, "Godspeed to you, angel girl." Like, she thought it was really a wonderful thing. It was just evidence of how very convincing Compassion and Choices has been in their media, in the way that they promote this. It's making people think that this is a desirable thing. And then there's now a whole website dedicated to Brittany Maynard that you can still go to, and it actually leads right back to Compassion and Choices and asks for donations. So this is what their whole plan was. Let's take someone beautiful and that's having an issue and really exploit it, and they did that. So
I believe they made a movie on purpose so that they could promote assisted suicide with this particular case. Now let's talk about her death and other deaths with assisted suicide. So they make it sound, they use gentle, peaceful, dignified, but it's not always like that.
Yes. No. Mm-mm. As I said, there's all kinds of things that can go wrong, and they don't necessarily die quickly. It can take as much as like 36 hours, or they just never get the right dosage, and then they're just suffering with terrible vomiting and just all kinds of things that can happen from these drugs that they're given.
Somebody actually brought that up in the workshop, and the person giving the workshop was very dismissive. And she's like, "Well, that just very, very rarely happens. Usually you get unconscious within like 10 minutes, and it's all very peaceful, and you just go gently into that good night." Well,
let's make this point too, though, Cindy. There's no supervision of this. How do we know that people are administering this to themselves properly? Not to mention, how do we know they're administering it to themselves at all? Somebody else could be forcing them to take it. And then, not to mention, let's say they take it, they get a prescription, they go and get it filled, they put it in their medicine cabinet, and then they decide, they're too afraid to do it. So it sits in the medicine cabinet, and who has access to that? Anybody. So a child could go in and get into these, or somebody that's mentally ill, or anything. It's just not controlled. It's not supervised. That's just another issue with it. I know originally Compassion and Choices was the leader of Dr. Kevorkian and his movement back in the day, in the late 80s, early 90s. That man was promoting physician-assisted suicide, but he knew it was illegal. So he had a little machine that he taught people how to hook themselves up to and kill themselves with. And he ended up going to jail over that. But it was called the Hemlock Society in those days.
That's the difference now between 1999 and 2024. whenever we started, it went from people being absolutely horrified by Dr. Kevorkian to, well, this is a good idea, in 25 years. I think it was
Yes.
1999.
I mean, it's just
1999.
amazing what a little good media and very, 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 they very carefully done this to us. They really have. So,
Well, I want to contrast the difference between assisted suicide, which may or may not be peaceful. I mean, there might be some times where you take the pills and just drift off and, listen to Mozart or whatever. And my mom. I just want to take a few minutes to talk about my mom's death because it was really a profound experience for me. First of all, my mother was not, she had Alzheimer's disease, so she wouldn't have been she wouldn't have been able to choose. Yeah, she wasn't a candidate for assisted suicide. She would have never done it, though. She was a very good practicing Catholic. But my mother was afraid to die. Even though she was a good practicing Catholic, she was afraid of the unknown. On one hand, on the other hand, she would talk about seeing her relatives that had already died, and she was looking forward to seeing Jesus and that sort of thing. But she did have fear. Well, she still had some cognitive ability. By the time she died, her cognitive decline was pretty severe. She wasn't talking much anymore, and she was obviously, a couple of weeks before she died, she stopped eating and drinking, which is totally normal, and that's very different than somebody who's like me or you who decides to do it because we're tired of living. Anyway, she had a process of death that I wouldn't have believed if I hadn't seen myself. She was very peaceful. Her last 10 days I was with her, and she absolutely was glowing. She was so happy. She had the opportunity to tell everyone she loved them. She told everybody, like the women who were changing her, like the nurses' aides, they would change her and she would say, "Oh, I love you." And she told us over and over, "I love you." Those were her last words to me out of her mouth. And my mom was a teacher, and the last thing she taught me is that death is a process, very much like birth. My sister and I were both like, yeah, this is kind of like birth. Birth has stages, and sometimes you're cheated out of those stages. And if you decide that, okay, I'm going to do medical assistance in dying, and so I'm going to go like Tuesday at 3:30. That's the day. That's the time, guys. So if you want to say goodbye, come now. You're not going to have that same experience. You're not going to have this peace. My mother really did have a peaceful death. Now, she was on hospice. And I think of hospice as kind of like the polar opposite to medical assistance in dying. It's helping you live with your illness as long as you're living, and then it helps you die in a way that's peaceful and natural. So it's a natural death. And unfortunately, some hospices are accused of like hurrying the process, but this was not our experience with this particular hospice, either with my mom or my dad.
well, you have to know that you have to know the hospice, obviously,
Yeah.
and do your research on
Well,
them.
they did give her morphine, but very, very tiny amounts. And my sister and I were like, well, why does she need it? And they're like, here, she's in pain. Here's how we can tell she's in pain. She's grimacing. Her neck is stretched and looks taut. Like that's not a natural way for your neck to be. So this is how we can tell she's in pain. And they did give these tiny, tiny amounts, like the smallest legal dosage of morphine you could get. And then she also got Ativan, which she'd been on most of her life. So I'm not sure if that even did any good. So I just think that what this taught me was, okay, first of all, medical assistance in dying is unnatural. A lot of times it's painful. It's ironic that it's considered cruel and unusual punishment, the ways they choose to do it when it's done in a death penalty situation. But the worst thing is I think you're cheating yourself out of something that you're supposed to have. One of the hospice nurses on YouTube constantly says, your body knows how to die. Just like we know how to live, our body knows how to die. When it's time, it starts to shut down. It's a process. It lasts from a few days to a few weeks to even a couple months. My mother started to shut down like around the 1st of April. The hospice nurse told my brother that she was beginning to transition, but she didn't die till May 20th. And the hospice nurses were wrong about when she was going to die because they told us on the Wednesday before she died, today's the day. Sometimes moms don't like to go and if you're in the room, so be sure to take breaks so she can leave. And I'm like, I know my mom. She doesn't want to be left alone. Don't do that. But we just started saying to her, "Oh, Mom, it's okay. We love you. You can go now." And she didn't die until the following Monday. So I'm almost positive as soon as I meet her in heaven, she's going to be like, "Why did you try to push me off the planet too soon? I wasn't ready to go." And the hospice nurse is like, "She's enjoying this. You guys have spent more time with her in the last 10 days than you have in the last 10 years because we all lived out of town and we'd come in to visit like a couple times a month, a couple times a year
Right.
until we were taking care of her full time. But we were with her the last 5 years. Anyway, I just wanted to make that point that assisted suicide is wrong in so many levels. And mostly, though, like if you want to think of something in a selfish way, it's because you cheat yourself out of the death you deserve. That's all.
Right. Well, the other thing is a lot of people feel like they don't want to be a burden to somebody.
Right.
And if they see themselves as having a terminal illness that's going to be expensive or you're going to take a lot of people's time, and they just don't want to have other people caring for them in that way. But that's because society has told them that they shouldn't be a burden to their loved ones. I mean, the fact of the matter is, we're called to take care of our loved ones, and we're called to take care of our parents. I mean, they took care of us, right? So it shouldn't be ever considered a burden. It should be considered someone's job, really, to take care of their
It was a
sick
joy
loved
and a
one.
privilege. It was a joy and a privilege to take care of my mom in her last couple of years. Okay, so we're almost out of time, but I just wanted to ask you if you had any closing thoughts.
Well, just that, this sounds like a good idea to a lot of people. And as I mentioned before, there's a reason why they have changed our language to make things sound wonderful and sweet and beautiful. They call themselves Compassion and Choices instead of the Hemlock Society because of certainly the connotation of what their name had in the past. And they come in sheep's clothing, but they are wolves. So watch out and keep this out of your state as much as you can.
Thanks so much for coming
Oh,
on the
okay.
show. So appreciate it.
Oh, well, thanks for having me. It was great. I love doing this kind of thing, and I'm so glad that we're getting the word out. And you gotta fight it. Compassion and Choices is coming if they aren't already in your state. They are coming to really push this and pull on people's heartstrings. And it's a misplaced compassion is what it is. So
Thanks so much.